Welcome to the Ask Dr. Tommy O Show. The Ask Dr. Tommy O Show is a show that enriches our community through health education. Today we have a wonderful show. It's a two-part show. The first part, we'll discuss the concerns of our community, which addresses health disparities in New York City. The second part of our show will address those individuals who made a commitment to our community, making a difference. So let's go on to our show. I'd like to introduce to my right, Bishop Timothy Burkett. Dr. Burkett, welcome to the show.
Thank you very much. It's been a great pleasure working with you, and over the years, you really, as a member of Church Alive, have really serviced our members, and you've kept me healthy well, and you've certainly done a major job in keeping them my members healthy, so thank you.
Well, we're working together as a team. But before we move on to my second guest, I'd like to also thank Dr. Burkett for allowing us to be in the house that God built, Dr. Burkett's church. Thank you. That's called Church Alive Community Church. For our second guest, my second guest, Lakeisha Grant. Miss Grant, welcome to the show.
Thank you. It's a pleasure to be here.
Thank you. Always. Lakeisha and I, we've been working together for the past 6, almost 7 years, making a difference in the community. Well, let's get on to our show. Again, the topic is disparities in New York City, healthcare disparities. First, let's define what healthcare disparities are. Healthcare disparities are when there is a difference, when one group has access to healthcare over another group. Why does this happen? Well, we need to discuss several issues. One, it could be race-related, discrimination-related, also could be socio-economical related, meaning wealth over non-wealth. It could also be one group has more education or access to information over another group. So these are some of the points that we're going to cover. For more information, I'd like to go to my site itself. That's the communityeducation.com, and there's going to be a link there that is covered by the Department of Health and Mental Hygiene, and this will link you to a format, a study that discusses health disparities in New York City. Very important. So let's start locally with Dr. Burkett. Dr. Burkett, how do you address health disparities in your community? And we're talking about the church itself.
Right. Well, what we've done is to have health fairs, educational workshops, where we can actually tell our people, show our people exactly what the problem is, also give them the remedy. Okay, sometimes people hear about issues, but they don't know that there's a remedy to those things. So we give health fairs here to show them that the importance of getting screening for high blood pressure and for diabetes, and these are the real killers in our community. And and also we give them education. We've had you many times to come in and just talk to them of how to take care of their bodies, and it's made a major difference.
Right. Well, that's an important fact. On this stage here, both Dr. Burkett and myself, we give presentations, lectures. Again, it addresses the health issues not only from a religious perspective, but also from a scientific or medical perspective, and that's where I lead my knowledge, my experience, and my education, my background. And again, we make a commitment, and our emphasis is taking a proactive, being proactive and taking care of your health. Lakeisha, can you give our audience some background on who you are and what you're doing?
Okay, well, I started out as a registered medical assistant since 1995, working with you for about 5 years. which was great. I learned a lot. I continued my education in college for a few years, and I moved on to become a group practice manager in 2 different practices.
Right.
Currently, I work as an allied health instructor at Sanford Brown Institute, and I'm also an educational coach and a CPR instructor.
Okay. Based on our topic, disparities in healthcare, in your personal life, how do you address these concerns?
Well, my student population is very diversified. I have an age range of 18 to 40, and some students take the program due to a career change, using it as a stepping stone, but a wide variety of students have the same issue, which is not having any formal education and wanting to make a positive change in their lives to create a financial stability for their family. So as an instructor, after them taking my course, they can basically apply what they've learned about health to their lives and become productive members in society.
Excellent, excellent. Again, making a difference. Very important when you have a positive role model in the community as an instructor, being able to educate. It's not just lending the knowledge of health, it's also educating and making a difference. Part of this disparity report, there is more than just take this pill. It's about a community working together to make a difference. They gave 3 or 4 different points. One would be working together. It's just not just the health and politicians, it's also the businesses as well that must make a commitment to make a difference. Dr. Riquette,
Right.
from a global perspective,
Right.
we spoke about at a local level within the church, but in the global perspective,
Right.
what are you doing to make a difference in our community?
Well, first of all, we take a holistic approach to the gospel. We know that God is not only concerned about our spiritual needs, but he's concerned about our physical needs as well. When they were hungry, he fed them, and when they were sick, he healed them. And so the church has to take a holistic approach looking at the care of God's people beyond the pulpit. And it's important because these disparities affect our families, generations to come. I mean, we have people here of color that have had diabetes from their grandfather and their father all the way down, and that's because it wasn't educated. The right foods they weren't eating, and you know, my father had died from diabetes, but again, he came from Barbados. And coming to this country, he did not have the education to know that he was eating the wrong foods.
Right.
And as a result of this, there's a strain of diabetes that's going through my family. Okay. Now, so therefore, on a broader scale, we have to look at the problem. We have a multicultural community, so we have many different ethnics, and they need to be told that the things that you were eating in your country now in this country is a big difference, and because our food is processed different.
Yes.
And so, therefore, it's a broad scale. But we know that something has to be done to deal with these disparities.
Yeah, I totally agree. We'll talk about the Bronx itself. Again, it's been documented that the Bronx is the #1 borough for individuals being obese and now morbid obese. And that's part of culture and the way that people, I guess, think about life and how they address their daily life. Part of it, let's say, cultural. The community at large, I'm going to say almost 50% of Bronx is Latin. Based on the Latin community, the type of foods that they eat, very high in starch. I mean, there's other communities that they have high in starch, like I'm Irish and Italian, so we're talking potatoes and pasta high in starch. But in this particular community, everything would be, has rice in their meals, and they might have fried chicken or fried pork chops. And this is something that we need to educate, and they need to understand that they have to make a difference in what we call it behavioral modification. With that, they will make a difference in their personal health. And you must be proactive, so that means you have to go out and you have to look and seek and become educated. If not, it's our responsibility, and we've taken on this challenge here. This panel has taken that challenge on to make a difference in our community by offering information through community outreaches.
Sure, exactly.
Let's go over a community outreach this last summer. We fed over 1,000 individuals,
That's right.
1,000 with good, high-quality food. Over the past 25 years, Bishop Riquette fed over 100,000 individuals from the Bronx.
Right, exactly.
How many community leaders can say that? That's 25 years, over 100,000 individuals.
Well, that's modest.